Welcome to BrainMindia Homeopathy Neuro-Psychiatry Clinic. Today I will discuss a psychiatric disease. It's an acute disease. The name is PTSD. The full form of PTSD is post-traumatic stress disorder. It is a stress-related disease. It happens in patient's life due to sexual assault, due to natural disasters, and due to loss of lives. So, patient come with us with stressful situation, having tension and depressive mood syndrome. Some people experience intense emotional and physiological reactions to remind that trauma. They can recollect with distress that traumatic event. Some people say numbness and detachment from others. Some experience interest in activities once enjoyed. They are having lacking. Anger outbursts are common symptoms of PTSD. Some negative beliefs about oneself, others of the world are experienced by PTSD patients. Memory problems are evident along with this trauma. So, we consider, having listened these kind of symptoms, that the case is a confirmed case of post-traumatic disorder, and I can tell you that post-traumatic disorder is an acute condition. Before going to the severe stage, chronic stage, it can be managed with homeopathic medications. There are several medicines, but I will consider some special medicines which give wonderful experience by the patients. Before coming to the treatment part, I can tell that those who are not having individual resilience and they are having lacking coping skills, they experience post-traumatic stress disorder. And as they do not get proper social support, some neurobiological considerations are processed through this post-traumatic stress disorder. So, to manage post-traumatic stress disorder, cognitive behavior therapy, commonly known as CBT, is evident. It is administered under the guidance of clinical psychologist. Besides expressive and supportive psychotherapy, directive and individual counseling is also administered. Besides medication, besides taking homeopathic treatment, if those therapies are taken, patient can be relieved within a short span of time from PTSD. Now I will consider some homeopathic grade medicines which can manage the case within 15 days to 1 month. Aconite is one of the greatest medicines for post-traumatic stress disorders. Both higher potencies and lower potencies works well for PTSD. Aconite 200 or aconite 10 mg. If it is administered with 10 mg, so patient has to take one dose twice a week for a month. If it is taken, if aconite is given 200, even 30 potency, patient has to take one dose thrice a day for 15 days. Second consecutive visit, we can consider argentum nitricum 200 and Staphysagria 1 mg potency. Staphysagria 1 mg potency, if it is given for complementary dose after having taken aconite for 15 days, patient is greatly relieved within a short span of time. Sometimes, because of some severe stressful condition, we have to consider in our prescription Coffea cruda mother tincture. It also works well for managing post-traumatic stress disorder. So, because of our extreme lifestyle modification situations, several people have been experiencing post-traumatic stress disorders in their day-to-day life, and they are going to the doctors. But before going to the doctors, you can well manage your case through self-counseling. If you cannot manage through self, you have to go first to the counselors, to the psychologists. It will be managed immediately. But when and if necessary for medications, think of homeopathy, as homeopathy is safe and without having side effects. It can manage the post-traumatic stress disorder within a month or so. Thank you for watching this video. Thank you.